Welcome to the Brave Enough Show. I'm so excited. This guest today is someone that I've met in the last year, and that I am just thrilled to be able to collaborate with her in different ways this year. She is a powerhouse and someone that I think is very relatable, and you're going to love to hear from. But before I get into that, I want to make sure that everyone listening knows that we are going to be doing the ninth Brave Enough conference this September in Scottsdale. And I want this to be the year that you come. If you're someone who has said to yourself, oh, I'm going to do that, I'm going to do it, this is the year. It's going to be incredible. We have an amazing lineup of speakers. I want to make sure that you spend time every afternoon on self-care. So the conference is literally designed for you to decompress in the afternoons, go to the spa, sit by the pool, network, read a book, take a nap, whatever sounds wonderful to you. And then we just have such a amazing curriculum, because the curriculum is really about the whole woman. And so if you're listening and you're like, I want to go to that, but I don't have time, you're the exact person who needs this conference. So go to braveenoughconference.com and sign up today. You don't want to miss out. Gift it to yourself and invite a friend. Okay, today's guest is, like I said, she's a powerhouse. Dr. Amna Shabbir is a dual board certified geriatrics and internal medicine physician. She's a master certified life coach, and she is a health and wellness coach. She trained through the Duke Integrative Medicine program. I know a lot of women have done that, and it's just such an amazing program. And I've met her this past year at an event, and I was just drawn to her energy and her warmth and her authenticity. And she's someone that I am just honored to bring on the show today. So thank you for coming on the show today.
It is an absolute honor. I am thrilled to be here, and I am also thrilled to pre-announce that I will be attending the Brave Enough conference this year. So
Yes,
I am
you
so
will.
excited of all sorts.
I know. It's such an amazing conference, and it's such a it's one of those things that I do. It's my favorite thing I do all year, but it's one of the things that I do that I feel like I'm going to leave my mark in medicine, because not because I get up and say anything profound, because I don't. It's just the gathering of women. It's like the bringing together of these women. People come to this conference and they change their life. They stay in medicine, or they decide, I need to cut back my FTE to pursue this passion, or they say, man, I want to get back to doing this thing in medicine that I love so much, that brings me joy, and I need to start saying no to these other things. They connect with people, they find joy, and I'm just honored you're going to be there, and you're going to be sharing your expertise with us. And one of the reasons I wanted to have you on the show today is because I'm doing this whole season about your personality, and how important it is for you to know your personality, know your strengths and weaknesses, and know your core values. And that is such a guiding point through life's hardships and through your career. And I think sometimes, especially early on in our career, no one sits us down and says, like, what are your core values? What are you good at? What's your personality? What kind of things do you like to do? What do you like to not do? And so I wanted to do this whole episode or season on this. And that this episode, I wanted to bring you on because you are a perfection expert. You coach on perfection. I've heard you talk on perfection. I think you have a different view of it. And what I want everyone listening to understand is, it doesn't matter if you're an introvert or an extrovert, you can be a perfectionist. It doesn't matter if you are an Enneagram 5 or an Enneagram 9, you can have perfectionist tendencies. We all can. And that's why I wanted you to come on the show today, because you're an expert in this. So tell us a little of your own story and how you got to be a speaker and an expert on perfectionism.
Thank you so much for having me, Dr. Shillcutt. So when I think about my story and what drew me towards perfectionism, over the last 3 years, I've had multiple moments and events, and you're like sitting down and trying to unpack what's wrong with me, because you want to fix yourself. Ultimately, that's the thing. Like, you're a project and you have to fix yourself, and only after you fix yourself, then you can thrive. And during this whole process, there's one common thread. First of all, I will preface this by saying nothing is wrong with me, and nothing is wrong with any of the listeners as well. We are all living in a human experience. When I look back and reflect, the common thread among all the experiences that I've had in life, from whether it was postpartum depression, whether it was burnout, whether it was just this extreme pressure to perform, it's perfectionism. And whether perfectionism shows up as my friend or as my foe, as that loud voice in my head, or on any other platform, it's always perfectionism. And so I became almost, I don't want to use the word obsessed, but deeply enamored with what it is, what it entails, and the different schools of thoughts surrounding perfectionism. And that's sort of what led me. I hope that by some point in my life, I will have unearthed some more details on it. I've been on this hunt, talking to bright minds about perfectionism and really soaking up all the research from it. What perfectionism in a nutshell is, I like the American Psychological Society's definition, although we don't like pathologizing people, but really what it stands for is the tendency to demand of ourself or of others this extremely high, unrealistic level of performance. It's almost this flawless level in excess of what is required by a situation. And that's really where I find where we're landing with. There are ways to differentiate it, but bottom line is, we like this dichotomous thinking. We like to think in all or none. You're a perfectionist or you're not a perfectionist. I like how you mentioned that you can be an introvert and you can fall on it. You can be an extrovert and you can fall on the spectrum. All of us, in some shape or form, are leaning into perfectionism by virtue of being alive in this day and age with social media, with all the things that are being blasted at us every which way.
I love this. And I think that you bring up so many good things to dig into right there. You said so many juicy words. One thing that I have found to be really true is that the reason that we hold on to things like false beliefs and perfectionism, all or nothing thinking, some critical thinking errors is because it serves us, right? So that's why you hold on to it. It's not just a learned behavior, it's because it's doing something for you. And I think oftentimes I hear perfectionism being used to elevate one's confidence and also to give someone like clout or give someone like that's feeling maybe questioned some sense of experience and confidence. For example, I'll hear someone say, "Well, I know I did that because I'm a perfectionist. I know I gave that medicine because I'm a perfectionist." Or I did check that because I'm a perfectionist. And yet we're all human and we err. And so sometimes I think that we use it as a protective mechanism because maybe we're not feeling believed, maybe we're experiencing like discrimination or bias or people or ageism or something in the workplace, and people are questioning us, so we say no, I really did like my very best. I'm a perfectionist. Like we use it that way. And yet perfectionism is something that it is impossible to have and not project.
Hmm.
I always find myself telling my kids like, "Oh, I don't care about that. I'm hard on myself but not you." But the truth is like if I'm being hard on myself, I'm projecting that onto you. So can you talk a little bit about, do you see that in the clients you coach? Do you see that in yourself, like the projection of perfectionism?
I love that you said that. And I made a little note when you talked about the dichotomous thinking, and and how we are using it as Dr. Tom Curran, who's one of the leading researchers in perfectionism, says that perfectionism, we tout it as our favorite flaw. And you're right.
Yes.
That's and
Yes.
that's what it is. It's our favorite flaw, except that this is a very dangerous narrative. And other researchers say, well, it's adaptive till it's not. And you're right. If I am putting myself on that pedestal, it is very hard when you look around, you're going to have those expectations of others. I was having that feeling right before we got on the call. I was working with my team, and I was having that feeling. Nobody can do this like me. No
Hmm.
amount of instructions are delivered appropriately because in my head, I have this narrative. I also have that self talk. Earlier, you mentioned something, I want to backtrack to that, was something you mentioned about values and how it's really important to lean into our values and be aware of that. One of the things that differentiates adaptive and maladaptive perfectionists is setting an intention, not just a goal. So
Mm.
adaptive perfectionists will have intentions and they'll have goals. So that means that they'll start enjoying the process right away. Whatever goal they're trying to achieve, they'll also be able to enjoy what comes before that. Whereas maladaptive perfectionists will always just be looking at this goal in sight. And when you're going to reach the goal, it's not going to be enough. The horizon is going to move, the goalpost will move farther, and you're not going to be able to actually lean in. So when you're operating from this capacity, you're taking all of that with you and you're presenting that in social situations. So then you're going to demand of others the same weight that you're carrying in and of yourself. And so it's really important for us to be aware of these tendencies. Now, there is still some debate. Some people don't even like the term maladaptive perfectionism. Some like the term adaptive and maladaptive. Some say that all perfectionism is bad, in fact. Some say all is not bad. And the reason I'm trying to bring all of this to our conscious awareness is, well, even the really, really smart people are still debating among themselves. But what we can safely say is that there are parts of it that can be extremely detrimental, extremely harmful. So when
Mhm.
we talk about having our surroundings and the energy that we're bringing to places and spaces, mostly we are in high achievement culture, in medicine, in any place there is a lot of stress, we're operating from maladaptive space. We're operating from a deficit thinking. So
Mhm.
what is deficit thinking and how is deficit thinking and that part of bad perfectionism different from healthy striving? Why should we focus for on healthy striving, and why should we not look on maladaptive perfectionism? So deficit thinking is, I think there's something inherently wrong with me and I want to run away from me, so I'm going to cover up this deficit thinking and feeling that I have with degrees, with accolades, with achievements, with more shiny objects, with other material possessions, because I think there's something inherently wrong with me. So I'm trying to run away and operate from that deficit. Whereas healthy striving is, I know I'm okay. I'm good enough. I'm okay. And but I still want to achieve. So it's a very subtle but really big shift that's present. Are you operating from deficit thinking? So when we talk about imposterism and imposter syndrome, it is going to be so much worse when you're operating from deficit thinking, because you're not only trying to run away from yourself, now you're also worried other people are going to find you running
Mhm.
away from yourself.
Right. This is such a good topic to talk about because you're right. Like the situations that we work in are so dynamic and they can be we can do something we can do these behaviors in one day taking care of this slate of people, and the next day we can try to repeat those same behaviors and we fail and fall flat. Like it's the most dynamic situation. I always say, like, if you want to be humbled every day, be a doctor or go into medicine, go be a nurse or be a pharmacist or something, because it is so humbling. Because you just when you think you have figured things out, you realize that we only know just a little bit of what we really need to know. And perfectionism is something that, as you strive for it in a stressful situation, it's only going to put more pressure on yourself. And you're going to worry more about what everyone else around you is thinking and doing, and you're not going to be in that growth mindset. So even if you're like, okay, I did this thing, I went through this day, I'm going to debrief with myself, and you're focusing on the perfectionism, you're not going to learn. If you're teaching someone and you're focused on the perfectionism, you're not going to teach well. And it's not that we don't strive for no harm or a zero harm, environment. Of course we do. But the truth of the matter is that we're going to have interactions that aren't perfect. We're going to have diagnoses that aren't perfect. We're going to do procedures that aren't perfect because we work in this highly stressful, dynamic environment where we don't know everything. Like, we literally don't know everything about medicine and it's constantly changing. So, I wonder, like, when you have a client or when you have trainees that you're coaching and or early career physicians that you're coaching, and they're just really struggling with maybe a past mistake or something that there's so much shame in, and you know that perfectionism is really holding them like in handcuffs, what is something that you say to that person to get them to snap out of this and kind of step back and go, okay, how can I learn from this? What can I learn from this?
That is an excellent question. And I really want to emphasize what you mentioned in there because, first of all, we just need to, I invite them to pause and I invite them to observe what they're actually witnessing. Because when you have somebody who's a young attending coming into you, they're already hyper focused on everything. They're hyper focused on their appearance, on what they're projecting. I am supposed to be I've done with training. Now I'm supposed to have all the answers, and that's what I should be projecting. So I should appear flawless. So a lot of what perfectionism does is, as you've mentioned, we're very outcome focused. It's all about appearances. So what's actually happening and what's actually showing out to the external world, there is this chasm there. And in that chasm is where there's shame, there's fear, and there's imposterism. And that's where all the anxiety is going to stay. So when you don't even know, when you can't even separate the two, so the first is to always take note, always observe. Do you want to journal? Do you want to? I frequently say, why don't you come and stand on the balcony and look down at what's happening right now? So the first thing is just observation because it's so dangerous when we perpetuate these narratives. As a perfectionist, you want to control all outcomes and all variables. So if you're fixated on the goal and then you're in medicine where nothing is in control, when you are taking care of really sick people, it is very difficult to detach your inherent worth and your performance as a physician and how you're showing up. It all turns into this convoluted mess. And the consequence of that is I just feel awful. I'm a bad person. And that self criticism just goes way up. So one of the biggest thing I note, and it's backed by research, is people who have the highest rates of maladaptive perfectionism are the least good at self compassion. So their self criticism is off the charts.
Mm-hmm. Mm-hmm.
So the first thing is absolutely to notice what is happening right now. What was that? What are the facts of this situation? I tell them you're a scientist. Put on your lab coat and just look at the facts. Facts are boring. Facts should not make you excited or entice any kind of emotion. Just look at what are the facts of this specific clinical scenario or something going on at your home as well. And then the second step is always, what is your dialogue surrounding this? Are you constantly beating yourself up? Pre, post, and after, we know those ruminations. Are you taking your computer to bed with you? Are you checking the labs? Are you just, it's okay. You can close the chart now. It's okay. And then the hardest thing, which takes the longest time, I myself am working on it, is self compassion, the hardest thing. And then how
Yeah.
can you actually even talking about self-compassion to people, it is so hard, Dr. Shillcutt.
Oh, yeah.
What is she going to say? Should I give myself a hug? Is that the solution here? So then we start talking about how can we make this tangible and palatable.
Yeah. No, this is so true. And it's, you know, when you don't see a lot of compassion for ourselves as physicians or as high achievers, and it's not just physicians, but whatever you're doing that, and if you're listening, it's very applicable. When we don't see it demonstrated, then we don't think that that's part of the culture and that's how we think we should just flog ourselves, like the more we flog ourselves, the better we'll be, the smarter we'll be, the harder we'll try, and it doesn't work. I mean, there's so much data and research to say that when you're trying to change or improve something about yourself, self-compassion is far far more effective than shame, right? And self like criticism, but we all do it. Like we all criticize ourselves. And it's really interesting because I agree with you. If I had to say, like, what is one thing that you constantly still struggle with, it's self compassion. I just went into a meeting last week and I thought I was really prepared for this meeting. And I had spent like hours preparing spreadsheets and a PowerPoint, and I was pitching my idea and everything. And one of the people listening to the pitch was like, well, have you thought about XYZ? And I
Mm.
was like, no, I have not thought about that. And part of my, part of me just kind of deflated. Like I felt this just sick feeling in my stomach because I was like, oh my gosh, I should have thought about that. Why haven't I thought about that? How dumb am I? Why didn't I think of that? And then I was like, I'm going to turn this around. I have to turn this around because they're looking at me like, well, how is she going to handle this adversity? You know? And I was like, no, I had not thought of that. I'm so glad you brought that up. Just embracing that growth mindset, which I think probably 10 years ago, I would have been like, oh my gosh, I wrecked that whole presentation. They were criticizing me. He asked me that question on purpose to show what I
Mhm.
didn't know, all the imposter syndrome. And it's like, why would I think that pitching something to people who know a lot about this topic, why would I think that I should know everything about any topic in the world? I don't. There's literally even the things I'm an expert in and stand up and give lectures on, I don't know everything there is out there. So when we embrace self compassion in the moment, we open ourselves up for learning because where that conversation went when I was like, no, I have not thought about that at all. And I didn't put that in my presentation. Thank you for bringing that up. It opened up this whole chasm of stuff for us to talk about and me to learn, where before I would have like shut it down and just been like, I didn't think about that. I'm sorry. I should have thought about that. I should have read about that. And then it would have just closed off the whole conversation. So I say that because I still struggle with this a lot. I still struggle with giving myself compassion and just remembering that growth mindset, remembering the word yet is so important that, you haven't figured that out yet, or you didn't succeed yet, or you haven't really overcome all your perfectionistic tendencies yet, but you're working on them, is such a powerful way to change the narrative.
I really also want to add over here what you experience is such a powerful representation of what actually happens because when you lean in self compassion, evidence shows that you are going to make better objective decisions. And when people who are self critical actually are more likely to blame others for their own mistakes. So,
Really?
yep, you're not going to be open to feedback. You're not going to be, because you're one of the core components of self compassion is mindfulness. And so, mindfulness will allow you not to blame the other person. Like your brain went to like these people have specifically asked me this question, maybe to belittle me, or maybe it's like they want me to look bad. And so now, when you take that narrative and you then have perfectionistic tendencies, it is extremely difficult to manage that situation because now your facade that was supposed to be flawless has cracked. And immediately your brain will jump to the worst case scenario, which is the dichotomous thinking. Either I'm going to rock this presentation or it's a dumpster
Right.
fire.
Yes, one or the other. Like it can't just be you did your best, you learned a lot. Yes. That's that all or nothing thinking.
And that is exactly why this is so difficult when we talk about perfectionism is a transdiagnostic risk factor for pretty much all mental illnesses that you can talk about, any concerns, anxiety, depression, everything. So it is important for us to challenge these norms. It's important for us to model humanity and being fallible so that people around us can also start breathing because the component of perfectionism that's rising the most is socially prescribed perfectionism. So if we can all start just opening up and part of like the conversations that you're having, it's just part of humanity. We need to model to each other. We are actually human beings.
Oh, I love this. And I'm thinking back to um some of my evaluations from my trainees early in my career and how they've changed as I have evolved and hopefully matured and become more self-aware and had improved my own intelligence, like emotional intelligence, because I look back and at the beginning, I wanted to be such a good teacher and I would just teach all the time and give all these every little lecture at the bedside and like in the OR I was constantly teaching, and the feedback that I would get, was Dr. Shillcutt is really hard. Like she's really smart. She knows a lot. She's really hard. Like she expects a lot of us. And I look and I'm like, that is when I was the least self confident. And I
Mm.
was projecting that on the trainees. And now I get at least once a year or twice a year, I'll get a comment that says, probably 5 or 6 comments in the last couple of years that say, I made a mistake and Dr. Shillcutt helped me through it. And I'm like, oh my gosh, this is like a reflection of me, because I have so much more compassion for myself now than I had then. I'm less perfectionistic. I'm aware of my perfectionistic tendencies. I'm aware of how I project that onto others. And I do want other people to feel like they can make a mistake and then we can debrief about it. And I'm not going to, like, you know, it's not a terrible thing. I don't want them to go home and ruminate about it. But it's interesting how we don't realize that we project our own feelings and our own thoughts and our own struggles onto the people around us. So it's so important that we have self-awareness and that we're just aware, like, oh yeah, I can be really perfectionistic at times, or these are the things that trigger my perfectionism, and this is what I'm working on.
Absolutely. I love that you talk about awareness, and it's critical. And then you take that, all of this, and I, we talk about medicine. This is a pressure cooker.
Yeah.
You take all of that, and part of who you were at that time, also, like with extreme love and compassion, is what you were modeled. You were
Mhm.
also modeled that. Other oriented perfectionism is heavily modeled in medicine, and there's no space. So they're two in parallel. Like, as you discuss that, what comes up for me is that you had your own internal confidence struggles happening, and you were also modeled like, this is how you just behave. You are perfect, and you show up and you do all of that, and that creates this like agony, and then everybody else is at the behest of it as well. So as you become more grounded and more rooted in your intention and your values and your self-compassion, it's almost like the storm starts to calm a little bit.
Yeah.
But you're
Yeah.
right, you just like re navigate yourself back to where it began.
Yes, yes. Oh, this is such good stuff. Okay, tell our listeners where they can find out more about you and read about you, because you are a phenomenal coach and teacher, and you have so many great resources to offer people. So let them hear all about where to find you.
Thank you so much. So I recently launched my podcast. It's called Success Reimagined. You can find all the links by going to dramnashabir.com, just my name.com.
And we will
Thank you.
make sure we keep that in the show notes. So thank you for joining me as a fellow perfectionist and being real and talking about it. And thank you for all that you do for so many physicians. It's so appreciated.
Thank you so much, Dr. Shillcutt. Likewise.
Okay, if you were listening, I hope you loved that. I hope that you just got just a dose of encouragement today and insight, and just taking a few minutes, as Dr. Shabbir said, and just doing some self-reflection. I love how she said, go to the balcony and look down. And we encourage you to do that today. We encourage you to think about where perfectionism is in your life. Is it limiting you? Is it causing shame? Is it causing you to ruminate at night? And how it's making you feel, and being self-aware of that, and then tapping into that self-compassion. And if you need a coach, there are so many amazing physician coaches. Reach out. I will help you. If not me, get connected to one, just like Dr. Shabbir. She is amazing, and you can also reach out to her. Thank you for listening, and I hope to see you at the upcoming Brave Enough conference. Again, go to braveenoughconference.com and mark your calendar. Get your ticket today.